Isn't it amazing that from touch, a response that profound can be evoked, and for that matter, from very gentle touch, compared to normal chiropractic adjustments? This is so subtle, it's like feather soft. What about that?
Well, the traditional adjustment intent is to try to realign or move a vertebra. I have no such intent, all that is an outcome. What I'd like to do is by applying a very gentle touch at certain areas of the spine called spinal gateways, with just sometimes as much pressure you may put a contact lens in your eye with, or about as much force as you may put on a closed eyelid.
Mm-hmm.
That may be enough to help the brain switch from defense posture into safety.
And something that subtle can cue something that profound.
Yes, Joel. I've assumed you've been in some relationships in your life at some times.
One or two.
Okay. Have you ever, with you personally, do you ever know anyone who someone just touched the person in what's called an erogenous zone,
Mm-hmm.
and the problems of the day disappeared?
I think I get the point. So something pretty gentle and pretty subtle could be pretty impactful.
No, there's no more stress, nothing. And actually, if you continue to allow the person to touch those erogenous zones,
Mm-hmm.
it doesn't matter who you thought you were, it doesn't matter what your identity was, you're going to go with the biological urge,
Mm-hmm.
and that's the key factor. Your biology knows how to heal you and knows how to make you well. Inside you have an urge, I have to do this, I have to stop doing this, let's change this habit. Those biological urges have been inhibited by the way we live our life. And as we make the contact called a network adjustment or entrainment at those spinal gateways, what happens is it's like touching a helogenous zone.
Mm-hmm.
By touching it, the rest of the world drops away. Your troubles drop away. The concept of your disease or your ailment, your circumstance of the moment drops away. All that exists is the flow of movement of energy, your breath, and your body's desire to be whole.
Are we then evolving toward greater and greater levels of subtlety in the way you treat people?
The way we take care of people?
Yeah, yeah. I meant treat them clinically.
Yes. And that's proportionate, that's in direct relationship to a person developing subtlety in their entire life. You see, what subtlety means is that you have more choice.
Mm-hmm.
Subtlety means you have more choice. Choice, again, is associated with the higher part of the brain. And when your brain is in defense, when your spine is locked in that position, when the vertebrae misalign, the pattern that produces that does not allow you to be able to make the choices that you know you can, but you just can't do.
Normally, that would be the domain of psychotherapy. But I understand from what you're saying that if you, as it were, entrain the brain, and I want to come to your definition of that in a moment, if you access the helogenous part of yourself, if you go to that part of yourself that is far more resourceful than your normal inventory of choices would ever lead you to think, that's great. It just continues to fascinate me that that comes from touching somebody at the base of their spine or touching somebody at the base of their neck, rather than sitting with a psychotherapist and saying, tell me about your conflicts, tell me about your dreams, tell me about your childhood.
Isn't it amazing?
It's totally amazing, and yet...
It's amazing to me every time.
So how did you discover this if you weren't expecting it?
Well, I was looking to find the most effective one place or two places I could apply a force to the spine for the brain and the body to coordinate more efficiently. And along the journey, I am an excellent observer of patterns. And just the right people showed up at the right times in my life to clunk me over the head and say, pay attention here. And what I found was that the contacts of the spine, or the adjustments that made the most difference, not only in a person's health, but in their perception, where the person would say, you know, I used to wanted to have a cigarette after every meal, and I looked at my body and said, I don't want to do that. What am I doing this to myself? was in a relationship with someone for 25 years and was abusive, and they said, no more, no more. Those type of things started happening when I applied a force or a gentle touch at the area where the spinal cord attaches to the vertebra. So if you think in terms of, I'm from New York, so I'll say bagels. Okay, if you think of a big cable going through a bunch of cable going through a bunch of bagels, that's a spinal cord going down from the brain out to the body to every cell of your body. And it's like a marionette puppet. And this marionette puppet, every cell has several nerves into it. And if you stretch the central cable, it stretches all the tissues and all the cells, and it changes the position. That spinal cord is attached inside the vertebra in the neck and the lower back. And for some reason, those particular areas are exquisitely sensitive to tension. If you change the position of the neck vertebra or the lower spine, it generalizes tension through the entire back. Actually, some studies show that if there's pressure on the nerves of the neck from a distorted spine, the spinal cord, distorted structure and posture, that produces 20 to 30 times the pressure on the low back nerves as anything you could do to them, including pushing on a disc or pushing on the nerve. Because the tension from the top, like a marionette string, is pulled all the way through the system. So when looking at that, I said, let me look at those areas. And then I started modifying the type of force applications. The key thing is this. If the distortions in your body and your life are associated with your brain not being able to make healthier choices for you because your attention's outside yourself, you're trying to protect your life. It's not time to think of what is my spiritual purpose in life. It's not the time to think of how can I give greatest service to humanity. It's not the time to think, well, how can I be more loving or be in touch with my emotions? It's time to protect yourself. Just get through another day, get through another week or another month. When the body goes from defense into safety just for a moment, the computer screen is wiped clean. And for the first time in sometimes someone's entire life, they have new choices available.
And this comes not from engaging the choices directly like you would in psychotherapy, but rather from altering, from transforming the physiology of the chooser.
That's exactly it. Allow you to be a better vessel for your physiology and your choice, and you might say your spirit. An important point in therapy, a person is usually trying to fix something or trying to, again, still return a person. We don't want to return them. We want them to establish a new. No matter what's been going on in your life, if you don't have new strategies, you don't have new options. If you're functioning with a 64K computer, don't expect to play the software that requires a Pentium.
But I am intrigued by the idea that your agenda is not to relieve symptoms. If somebody comes to you and they're in pain, something for which they might see a conventional chiropractor, do you not have as one of your objectives to remove the pain?
No, that's not my objective. It would not be fair to them. There are many, many people.
It would not be fair to them to remove the pain? I'm sure most of them would agree to it if you gave them a choice. Because
the idea is, as long as the pain is redirecting them into doing different things or not doing different things, making different choices, there's something to be learned from it. But I don't want to be insensitive to the pain. What I do want to say is this, is when that brain goes from defense into safety, and the brain can start reassessing its tension patterns, taking tension off that spine, one of the things that research shows is people's physical pain does go away. But I don't want to position what we're doing as pain relief, because that person, if they just had their pain go away, they would go back into their old life in the same defense pattern, then that person can't get a new life.
Thank you for watching Network Care Part 2 by Dr. Donnie Epstein. Please continue to Part 3 or visit wiseworldseminars.com to find a network care provider near you. Have a great day.